Go.
Shalom. Thank you for joining us. I'm Leonel Karasik, and I'm the Director of North American Partnerships at SOHAR. First, let me explain to you who we are. When we say grace after meals, we say Ayinu kecholmim. We were like dreamers. 25 years ago, Rabbi David Stav, Rabbi Yuval Cherlow, and others, they founded SOHAR with a dream to unite all the Jewish world around a Jewish identity that is relevant and responsive to our daily challenges and dilemmas. This is why today I have Rabbi Yuval Cherlow and Dr. Schwaber. They're my guests today for this amazing debate. Hopefully it will be amazing. Thank you for joining us.
Pleasure.
So you all can hear me? We're good? So let me introduce you my guests. I think you all know Rabbi Yuval Cherlow. He's quite famous. He's the director of the Zohar Center for Jewish Ethics. He's a Rosh Yeshiva and Posek Halacha and a public figure in Israel. And we'll have also Dr. Schwaber, who is the director of the National Center of Infection Control of the Israeli Ministry of Health, and a doctor at the Tel Aviv Sourasky Medical Center, and he also serves as an expert at the World Health Organization. I think we have two amazing specialists, and this is going to be an amazing debate. So I think we should start. Let's start with a lighter question. I just saw a video of Rabbi Daniel Sperber reciting Shechianu when he took the vaccine. I'm not asking for a halachic opinion, but should we be saying Shechianu for this moment? Rabbi Cherlow, how about you start?
I'll divide my answer into two parts. The first one is, should we thank Hashem for the point that we reached? And I think the answer is yes. I do believe that a lot of efforts were made by doctors, researchers, scientists, and all kinds of people that did everything they could in order to develop this vaccine. And I will not forget all the volunteers that were willing to be, human testing of these vaccines. When you introduced me, I wanted to add the fact that I'm part of the high-level committees in Israel that are approving research on human bodies. So I really know this area quite good. And as I said, it's really, thank you also for all these volunteers, and that's from one hand. On the second hand, everything that is happening in this world, we do believe that there are fingerprints of Hashem everywhere, and we pray and we say every time we pray, "Atachonen ladam dat," that our abilities and our knowledge and our all of our equipment and whatever we have is from Hashem, and therefore we should thank Hashem that we reached, and we are now in a point that there is a vaccine. We should be a little bit careful with thinking that the redemption is here and the Messiah is here. It probably will take more time. It will be more complicated, and new problems will appear. But thank you to Hashem. The second answer is the second part of the answer is halachically, and I don't think that Shechianu or Hatov HaMitiv are the right blessing to say in this point. Tomorrow morning, my wife and me we have an appointment to get this vaccine. Probably will say Mizmor LeTodah, thank you to Hashem, about the fact that we got this vaccine. But levarech on it is too big.
Okay, Dr. Schwaber, how about you?
Well, thanks, Lionel. I don't want to disappoint, but based on because you promised your audience a debate, but based on Rabbi Cherlow's answer, I have a feeling that we're going to be seeing eye to eye tonight a lot more on than what we're not. So, but I hope to be able to fulfill the promise of the debate in some form in any way. So to address your question from a medical point of view, because clearly I'm not the halachic authority on this call. So I'm not going to address the halachic ramifications of saying Shechianu. But what I believe lays behind your question is this a exceedingly momentous occasion in the history of this particular pandemic and in medical history and human history? And I would say that the answer is unequivocally yes. The advent of vaccines for this pandemic, the beginning of being able to give a vaccine, actually, we now have 2 in the Western world, 2 approved available vaccines that have been not only proven to be safe, but overwhelmingly among so many of our best expectations, we would have settled for something much less effective, but effective. And these 2 vaccines from Pfizer and from Moderna, the results on them are so impressive, both for their safety profiles and for their efficacy profiles, that this is really a huge moment. And when I try to think, to put it in some perspective, I pulled out an article from the Chicago Tribune from April 12, 2005, and it was marking the 50th anniversary of Jonas Salk's polio vaccine. And the article starts, I'll just read the first few sentences. It was a celebration worth remembering 50 years later. Throughout the nation on April 12, 1955, church bells rang out. Kids were let out of school. People danced in the streets. Polio routed, newspaper headlines screamed. Salk's vaccine works. The trust of American people, chipping in a dime at a time, had been placed in medical research, and they had been repaid in full measure. Summers no longer would be times of terror. Parents slept a little easier that night. That is something that in the lives of our parents, they likely remember. My own medical history, the only thing that I can sort of see with this degree of magnitude of providing hope to humanity was when the highly active antiretroviral therapy, or what's colloquially known as the AIDS cocktail, was introduced in late 1995 and 1996, providing hope to what was until then an almost universally fatal disease. So we have had a year of just going from sort of one sobering, in many cases catastrophic moment to another. And we are, there's no question that we are now at the single most optimistic moment we've had since the beginning of the pandemic. So that is my answer to your question of whether we should be making a Shechianu at this moment.
Okay. All right. So you both were very optimistic, and I mean, also optimistic. But I've been reading the news, especially here in Israel, and apparently 75% of the population said, or they are not willing to be vaccinated now. There is a spectrum, or now they won't be the first ones, or they won't get vaccinated at all. And I think there is a contradiction here. Such a positive moment, took 1 year to find out something that potentially can eradicate the disease. And so many people were fearful. I mean, why? Or maybe one of you know the answer, and I would love to hear.
First of all, I don't believe these are the real numbers. Okay, I think it's exaggerating. It's a lot of exaggerating, and I think that we'll see at the end of the day, that the vast majority of Israelis will get this vaccine, will be very happy with it, and I think the data is so wrong. From my experience and from my dealing with people and whatever, I assume that there are approximately 20-25% that are debating, and most of them will be vaccinated. That's it's not only feelings. I work in this field, and I think this is the situation. But I think that it is an opportunity to understand how important confidence is when we are talking about authorities, when we are talking about companies, when we are talking about everybody. And the problem today in the whole world, but especially in everything, we lost confidence. First of all, I'll speak about myself. Towards rabbis, towards religious authorities, we lost confidence. Towards medical companies, we lost confidence towards the government, and the government, earned it without any doubt. Don't forget what happened on Leila Seder last year as an example of losing confidence, and no one believes no one anymore. Not the news, not the explanations, not anything. And this is a real problem. So therefore, as I said, I'm not sure that these are the numbers, but people are I'll say it that way. This is a real opportunity to ask ourselves, how can we reconstruct? How can we build from the beginning everything that people will believe that, first of all, we have honest motivations. We are not, the people want, in general, to do good things. And they mean what they say, and facts are facts, and opinions are opinions. And the distinction between facts and opinions is very clear. And all the basis of building or rebuilding from the beginning, the fact that we can trust someone that says it's safe, or someone that says there is a problem. And I will add another small thing, or maybe big thing. The first step towards confidence should go through transparency. That means when people are talking honestly, they say this is the horizon, this is the important effect that can be with this vaccine. These are the things that we still don't know. We didn't test it. We don't have enough experience. It is a debate. From the third side, the pandemic is very dangerous. So when people will speak clearly, the people that support the vaccine will not say, we know for the 100% that nothing will happen, because you don't know. And from the other side, people that are against will not say crazy things against the vaccine, and will lie, with facts that are completely wrong and completely don't have any base in the real situation. And the music will be, let's face it, this is the picture, this is the pluses, this is the minus, this is the dangers, the dangerous situation. I think that transparency is the first condition in order to build confidence that this is the most important thing.
Rabbi Cherlow, if I understand correctly, you're saying that, if I understand correctly, this fear of the unknown, of the uncertain, is part of the component why people don't really, it lowered their trust, or they don't trust the vaccine or the institutions. Is that correct?
Yeah, we have to make a lot of decisions when we don't know the whole picture. This is life. Safek, as we call it, is part of halacha, is part of ethics, is part of everything. But also, when you don't know the entire picture, you have to make decisions. And you make decisions when you calculate all the components and you are testing everything, and you say the truth. And when you say the truth, you build transparency, and from transparency to confidence, and then people will make the right decisions.
Okay. So, Dr. Schwaber? So
I agree that I think that 75% is a little bit high, an estimate for people who didn't want to have the vaccine up front. I agree that sounds a little bit higher than numbers I had seen, but there still was a disturbingly high percentage of people saying they wouldn't get the vaccine. And I think a number of the reasons for that, Rabbi Cherlow just pointed out, and an eroding of trust in our elected leadership, people who should be role models among those reasons. But I think that in the course of this pandemic, the scientific community has maintained its ability to put forth data. We haven't been flawless, and there have been ups and downs. But when you look at the big vaccine trials that are coming out, they're published in peer-reviewed medical journals, and the big pharma companies who are making the vaccines have independent advisory boards, review boards, who are evaluating the raw data and assessing it. And so they're people who are really interested in the science have transparent science available to them with large numbers with which to arrive at the conclusion that this vaccine is safe and effective, the two vaccines that have been approved. Now, having said that, still no one wants to be first. People are really not, as a general rule, interested in being guinea pigs. So first of all, nobody is first in when the vaccine becomes approved, because the people who are first are the people who participated in the trials all along. But still, no one wants to be, or I don't want to say no one, but a lot of people aren't excited about being the first ones in the chair when the vaccine is made available to the general public. But as time goes on and we see more and more people getting vaccinated, and the world gathers more experience with this, we're seeing a lot of the initial reluctance and opposition that came not from being an anti-vaxxer, but just from genuine fear eroding away. There was an article in yesterday's New York Times by Jan Hoffman. The title was, "Early Vaccine Doubters Now Show a Willingness to Roll Up Their Sleeves." And the article goes in and it explains why. It interviews several of these people, and it talks about their various reasons for their changing their mind and being eager to get the vaccine. And among them are the fact that it is so effective, the safety profile, and the fact that the disease is so devastating. And the disease is truly devastating, not just for the people who have severe disease at the time, and for those who unfortunately don't recover and go on to die, but we're more and more becoming aware of late effects of people who had even mild disease. So this is more and more people are becoming more and more aware that this is an illness, this is a vaccine that is worth taking the measures necessary to avoid. And vaccines now are among the most effective measures that we have, aside from all the non-pharmacologic measures. And with all that, there's still a lot of fake news out there. And with the social media being able to indiscriminately spread fake news and expose an unknowing public that has a hard time discerning what's real from what's fake, I think it behooves us in the responsible scientific community to spread the word about the science. And I'm not normally a big user or consumer of social media. I don't have a Twitter account. I have a Facebook account that I barely use, mostly to try to spy on my daughters until they realized that they moved on and left Facebook to the older people. But I think that the social media presence of people who are looked up to as people of science, and people of religious and spiritual leadership, and and political leadership, people who are looked up to as responsible leaders in society, going on camera, getting their vaccine, showing it to the public, putting it on Facebook, putting it on whatever social media and on whatever conventional media, and getting the word out. I think that's a tremendously positive step towards convincing a wary general public that it's worth getting vaccinated. And I think the numbers are speaking for themselves, because in Israel, we're 1 week into this, and within the first week, approximately 280,000 Israelis got vaccinated. That's over 3% of the population. That is really, really impressive figure.
It is. But okay. I'm not going to say that I'm completely convinced, because there is one fact. In the end, if one individual does not want to get vaccinated, he won't. I mean, I assume he won't. And so this question is twofold. First, is it legitimate? Can I just say, I'm not getting vaccinated? Just to explain, I came from a country, I was born in Brazil. For many years, sanctioning those people was normal. You know, you had laws for it. And for example, I remember schools could refuse kids that were not vaccinated. This was normal. And so the question is the following. First, is it legitimate? I'm talking an individual above 18 years, you know, fully conscious. And second, can the government force or sanction these individuals? Like forcing them to get vaccinated?
Dr. Schwaber, you start.
Oh, okay. All right. Fine. I'll start this time. So I think, look, when you say, can the government force an individual to get vaccinated, it depends which government. If you're the Chinese government, you clearly can. If we're in the democratic world, then we have a basic principle that you can't force any thinking independent individual to take anything into their body that they refuse to do. So in that sense, yes, individuals can decide whether they're going to get vaccinated or not. Having said that, no individual has the right or the legitimacy to put others in harm's way because of a decision he or she makes. Meaning, if you're a healthcare worker, and a healthcare worker, a hospital or a healthcare employer decides that if their staff is not vaccinated against whatever disease it is, then they put their patients at risk, they can condition hiring on that person getting vaccinated. And before I moved to Israel, I worked in a hospital in the United States. And when it was time to get my annual tuberculin test, they said, you know, it's your day to come. You can come, and if you don't come, you just don't expect your paycheck in the next mail. You know, that's the way it works. So they weren't forcing me to get vaccinated. They weren't violating my rights, but they were also behaving responsibly vis-a-vis their patients and not allowing their staff to put their patients in harm's way. So I think that, you know, when we have, and we have examples, for example, something where there isn't an effective vaccination, like, for example, TB, okay? If somebody has active pulmonary TB, the government can come in and forcibly admit that person to a TB ward so he doesn't put the public at risk. So when we have now a vaccination that we say will not only protect you from illness, but protect others from getting an illness from you, we have the possibility to, while not forcing anybody to get individually to get vaccinated, to say we're going to condition certain privileges on your getting vaccinated. If you want to work in a healthcare facility, if you want to go to an Yarok, to a hotel where we're allowing only vaccinated people, if you maybe in the future, if you want to get on an airplane, there's all sorts of possibilities. We're still at the very beginning of this, so I think this hasn't been fully worked out, but there are mechanisms that we can put into place where we at the same time respect the individual's right to make the choice whether they're going to get vaccinated or not, but also look after the public's interest to not have public health threats threatening them just because an individual person decided not to get vaccinated.
As you said in the beginning, I'm very sorry, but I don't see any kind of debate. I completely agree, completely, and we wrote about it. You know, we have a big website of the ethics department of Tzohar, and we wrote exactly this opinion. I'll say it briefly. You cannot punish someone, but also the majority have rights. And they have rights to protect themselves, and not as a punishment, not as sanctions, but when there is a necessity and it's proportional to protect the majority right to have good life without the pandemic, and people, the minority or the individuals decide they don't want to be vaccinated, they can do it. but the majority have the right to protect itself and to say, okay, but you cannot come to a big gathering and to all kinds of places where you are endangering and causing harm to the society.
But let me go a little bit more further into this. I see every day this whole idea of COVID shaming, that you say, well, you can't party, you shouldn't post those pictures on a social media that you're having a gathering, and even on the news, you can see certain celebrity without a mask. But I mean, I'm sorry to say, I've been seeing this for 8 months now. People have been shaming and saying, you're wrong, you have to do it. Try to foster this attitude of, take care of yourself, take care of the others. I don't really understand if this is actually working that much. Why would it be terribly different with the vaccine? Because apparently the willingness to enforce it needs to be also, from individuals who are willing to say, well, inside my store, I'm not getting anyone who's not getting vaccinated. So it feels like there is a complicated, equation here that looks uncertain. What do you think?
In every ethics dilemma, there is a question where to draw the line. Because in most cases, dilemma means that there are good arguments in both sides, and you have to draw the line somewhere, okay? So it is a good question. What can you do? Now, I can't answer the question if it's effective or not effective. This is not my field, okay? You have to ask psychologists and who knows who, if it's effective or not effective. But if the question from my perspective is if there is a right to do that as an individual, I mean, to shaming in all kinds of things. So in ethics, we have three measurements that we are asking ourselves. The first one is if it's necessary, if there is a necessity, or there's a different way, without shaming, without, trying and designing the society with all kinds of fights and combats and whatever. Is there a way to try to convince, try to speak logically, to encourage, to pursue? And you have to ask yourself, is this the only way? And are you sure it's effective? And if it's so necessary to do that? And that's are limiting a lot of shaming that people are using. The second question is it proportional? I mean, that even if it's necessary, we always have to ask ourselves, to see what is the risk from one hand and what is the weapon that you are using against it. Because in many cases, shaming can cause so much damage to the individual. But as I said before, from the other hand, we have to protect the right of the majority of the society to exist. So you have a balance between those two things. The third thing is, if a question is, can you use shaming in the best way, without pictures maybe, without names, talking about the general idea that people should be vaccinated, whatever. So when you're trying to draw the line and balance and you use necessity, proportional, and not to cause damage you do not have to cause, I think you can find it leads to how to a instrument that can help you how to navigate and how to make the decision. We always have to think about the future, and from the future, from one hand, it's a danger to the society and people will get sick or even injured. And I want to say that one factor that we are not talking enough about it is not only the pandemic, is not only being ill or being or die, chas v'shalom, but it's also the fact that the health care system is so concentrated in the numbers of the coronavirus that other fields of the medical equipment and the medical concentration and whatever is being a band-aid. And that's, I think, something that we're not talking enough about, because the numbers of coronavirus, and you hear it from everywhere, people with cancers, people with other health problems are less being treated correctly because of the coronavirus. That's from one hand. But when we think in the future, we have to also think that we have to live together later on, and we have to be a unified congregation. So we have to be very careful with the shaming. So the bottom line, I say, you can use shaming after you're asking yourself 3 questions: the necessity, the proportional, and are you careful not to cause any damage? And then this is the way, because if you cannot stop people from risking the society, you have to do something.
Okay, Dr. Schwaber?
So, I would add, first of all, as an epidemiologist, your question, Leonel, is, okay, so we have people out there doing COVID shaming, and yet I'm seeing the malls packed, and people congregating and not listening. So clearly the shaming that's being done isn't working. So as an epidemiologist, we have this concept called selection bias. There's selection bias because you're seeing the people who are out there congregating. You're not seeing all the people who are in their homes because A, they're either want to do the right thing because they believe it's the right thing to do, or B, maybe they're afraid of being COVID shamed. And so maybe the COVID shaming is working, but you're only seeing the ones it's not working on. So, but having said that, I'll say a few things about it. First of all, I'm not wild about the term COVID shaming. I'm not wild about having to resort to shaming in order to bring about a public health imperative. I think that the key measures I would like to see in place are solid education and ongoing, if you have to bang your head against the wall, education, unremitting against people who either are influenced by fake news or just don't get it for whatever reason. And B, sanctions, enforcement. I hate to have to resort to shaming to get people to do the right thing. Now, that doesn't. I do believe that shame is a good thing in the sense that our own personal sense of shame is what keeps us from behaving improperly. But having to resort to shaming somebody else, whether it's the media that does it, whether it's an individual that does it, whether it's a teacher that does it in the classroom, or a parent that does it to a kid, or a spouse that does it to another spouse, no one on the receiving end of being shamed ever enjoys the experience. Even if you're the one being shamed and you know that you actually done something wrong, the initial human response to that is to be immediately unhappy by the fact that you were shamed and put on the defensive, and maybe even strike out and say, that person is not going to tell me what to do. So I think that as a society, we definitely do have a responsibility to not only make public health policy, but to enforce the implementation of public health policy. And in a democracy, by definition, enforcement is going to be limited. It's necessary, and I'm not saying there has always been enough enforcement, and in many cases, there hasn't been enough enforcement. But I think in addition to enforcement, we have to have unmitigated education. And education means at every level, so that if I have a staff member who doesn't want to get a flu shot because he'll say, I'm not in a risk group for flu, and I've never had flu before, and I just don't, I'm really not at risk. It may take saying, but you go on to at-risk wards, and even if you don't have a severe case of flu, and even if you have such a mild case of flu that you're not even aware you have it, you can transmit it to one of your patients, and that patient is in a risk group, and he can get very sick or die. sometimes that is enough of an eye-opening conversation for that person that person will then go out and get a flu shot. I can also come back with a sanction and say, you know, you have to get a flu shot if you want to work in this department. But that's the way I would do it, rather than putting his face up on the screensaver and say this person didn't get a flu shot. So that's sort of where I come down on shaming and coercion.
Let me pick up on this. You just bring me back to some very interesting terms that people use in economics. We just discussed negative incentives, shaming, coercion, but there are positive ones. So I read this very interesting text by Richard Thaler, who was a Nobel Prize winner, and he wrote the following. He said, you want to get people to get vaccinated? Auction vaccine shots to celebrities. Because, you know, they have money, they're going to pay a lot, you're actually going to redistribute well, because you will pay for the shots and for the shots of, who knows, many more people. And eventually people will look at them as role models. Imagine if you see the American audience, Brad Pitt getting, or for the Israelis, Dani Kushmaro getting vaccinated on TV, you might say, well, maybe I should. But I think there's a problematic here in this, what he's saying, an ethical issue that he's okay with it, but I would love to know your opinion.
Well, I think, first of all, I have a little bit of a problem of, when you say auctioning off, I have a little bit of a problem with money being given in order to get, a medical treatment of any kind. So I would sort of take the financial element off the table. I think that it really depends what it is you're auctioning off. It depends on how you want to use the celebrity getting it, right? I think for COVID vaccine, it would be a wrong approach, because COVID vaccine, at least now, is not something that is being evenly distributed among the whole population. There are clear priorities for who should get vaccinated. First, who was on the top priority list, and who was on the next lower down, and who was on the next lower down. And each society is making these up, making up these lists of priorities, but they're all more or less derived from the same principles, based on what we know about this illness and who gets the most sickest, and who comes in contact with the most people. And so it's not something that we want, it's not an educational message that we want to deliver, saying we're going to get the celebs to give it first because they'll have such a following that people are going to go out and get vaccinated. No, we have right now a limited number of vaccines. We want first the sickest, or not the sickest, but the most at-risk group, to the highest priority group, to get vaccinated, and then go down the list until we're able to open it up to the general public. But on the other hand, if you have a vaccine that, for a hypothetical vaccine, for a hypothetical illness where you want it rolled out initially to everybody, then having the celebs come out in front and publicize it, by all means. That doesn't mean paying them for it, but it does mean getting them to put it on their Facebook page, getting them publicity, getting them to on all their social media and all the cameras. And I think even with COVID, the celebrities can be mobilized to push the safety and the efficacy of this vaccine. Maybe you can have celebrity parents who are elderly volunteering together with their celebrity offspring to show how the Hollywood actor attends his 70-year-old parents getting their vaccination, putting it up. So there's a lot of creative ways you can mobilize the potential selling points of celebrities for the good of getting the public vaccinated.
I'm against for three reasons. The first reason is because in this point, before you encourage and pursue people that don't want to get the vaccine or are not doing the efforts in order to get the vaccine, we should use every shot that we have to give this vaccine to the people that do want, first of all, the priorities, and then the second level, the third level. Maybe when we reach a point that when nobody's coming and we have enough of shots, okay, that's maybe then. But in this point, I'm against. This is the first reason. The second reason is much more important from my point of view, and that is the long-term consequences of this policy, and that is the fact that celebrities are willing to get this vaccine, or even convincing people to take the vaccine, doesn't really mean anything. I want the government to speak to the publicity through scientific, through doctors, through ethic experts, through people that are using a logic argument, a reasonable thing. I mean, I don't want. I mean, the government is using such a low level of intelligence. The fact that a singer or basketball players getting the vaccine, this is the reason that you should decide also to get the vaccine. So maybe people will come to get the vaccine against COVID-19, but actually we are reducing and we are lowering the public conversation and things. How should the government convince the society to do things? And we'll pay a very high price in the future, because the way to speak to the public will be through actors and not through people that are authorities in their field. And this is the second reason I'm very against.
I think
okay, it's enough.
Just a little bit, I think. No, I'm just saying. I think you're saying to the future. I think it's already, we're reaching that level a little bit.
Okay, so it's bad enough. And I'll say very briefly the third reason. The third reason is because we saw this week, once you start with celebrities, then they have a whole bunch of people around them. It's also the drivers and also the photographers, and although everyone that is around them, then it's causing a feeling in it's not only feeling, a reality, a situation where people are against losing their confidence that these vaccines are being distributed according to rules, to ethical rules, to the necessity, to the priorities, and are starting to be, we say in Hebrew, karov latzelachat, so I'll say it in English, near the shot, yeah? And people are getting these vaccines because they have all kinds of relationship with the authorities and with the system. It's bad. So these are the three reasons why I am against, and I prefer that instead of that, doctors and rabbis and I don't know who, the right people that will try to convince and talk to the people to the high level of their knowledge, and not through the fact that a basketball player that I have a lot of respect towards him. I can't play basketball. Okay, but a basketball player will get this shot. I'll say I'm not joking, but in our group of the family, someone said, "Oh, it's such a pity that this vaccine is on your arm and not on where you sit, because then nobody will show his picture on the social media getting this vaccine."
So you have your debate so far, because here we finally have a point of disagreement. Because I gotta say that I'll just take 1 minute to respond. First of all, I share every one of Rav Cherlow's concerns about and particularly about dumbing down, and to use an American expression, dumbing down the conversation. But there's a few things that I've learned to respect, basically also because having teenage daughters, and some who have recently emerged from teenagerhood, is the enormous reach of certain people I mean, you're talking about something called following in social media and realms that I can't even comprehend, that they reach so many people. So when you have an important message to get out, to have that as a potential resource, then the question is, you certainly don't want to dumb it down to the level of some sort of mindless TikTok thing. But on the other hand, you have examples that you can go to of tremendously important public health work in malnutrition, in AIDS, in orphan rehabilitation, where Hollywood celebrities have enlisted their names, not instead of the public health authorities, but in concert with the public health authorities. Instead of dumbing down the conversation, they have joined forces with the public health authorities to boost awareness and generate resources for these important public health and public service endeavors. So I think that there are ways that I wouldn't call it all puzzle. I wouldn't call it using celebrities something that's null and void and shouldn't be looked at. I would say it's a challenge. There may be creative ways where we can do it in a positive, constructive, and scientifically and intellectually appropriate way.
Just because of time, I would dwell on this question a little bit more, but you spoke a lot about priority, both of you. And I read on the news today, not judging, that the Teachers Association in Israel, they said, well, if we don't get vaccinated as a priority group, we'll go on strike because we're not coming back to work without vaccines. And number one, this question of priority, instead of organizing society, might be actually triggering conflicts, because people will know. They feel like, well, why is this group a priority? Why not me? And do you have, again, your impression, is there a clear ethical framework or medical framework to decide which groups should be prioritized when getting the vaccine?
I'm going to let Rav Cherlow take this one first.
No, first of all, it's a professional question. I mean, I'm not a expert in trying to write the priorities and if educators are more in risk or less in risk. I think the priorities are actually most of the ethical people will agree, except something that happened in the United States about crazy idea. But except that, the priority is very clear in general. That means the first place, the staff in hospitals and that are taking care with the people that are sick in coronavirus. The second one is people that are under risk, especially people that are in nursery homes. You know, third, fourth. It's not a big issue. I don't like the music of going on strike if we don't get it before. Again, I am going back to what we started with. There should be confidence in people that are professional, that are writing the list, transparency. These are this and this and this and this, without pressure and without being making concerns and being surrounded by all kinds of people that have different interests. And I think that in most cases, the professional can come to a logic and honest and fair list of who's first and who's second. I can't make the list because it's not my field, but I can say that I'm supporting the idea of making a list without any other reasons except medical reasons. And then these criteria should conduct and be the paradigm that the whole state is working according to that, without making any, eyesides or whatever, in order to keep the confidence and the respect towards these principles.
So I would add to that. I think that there is an ethical element to every question when it comes to distributing resources, whether they're medical or not. But, you know, when we're looking at the specifics of coronavirus, first of all, there's no public health authority anywhere who has an interest in denying the vaccine to anybody who is medically eligible to get it. Everybody wants, every responsible public health authority wants everybody who is medically eligible to get the vaccine as soon as possible. Now, the question is, initially with the rollout, you don't have enough, okay, to give the vaccine to every single person in Israel who's medically eligible. When I say that, I mean you can't give it now to under 16 because the Pfizer vaccine is from 16 and up, okay? But if you look at, you don't even have enough to give it at this moment to every single person who's 16 and up in Israel. That's the goal, but you're not there yet in terms of supply. So you're forced to making a priority list because that's the only responsible way to behave. So how do you do it? I mean, you look at all of the numbers and all of the epidemiology. You look at the people who are providing healthcare in the hospitals, and in the clinics. So these people not only can get sick, they can make others sick. They can infect others because we're dealing now with a specific virus that you can get infected with, and you can infect others, and you can infect others without even knowing that you're sick. You may wind up getting it, being infectious, being contagious, and not knowing it until a day or two later. And in the meantime, you may have affected others. So if you're a healthcare provider, the society clearly has an interest in getting the healthcare providers vaccinated for their own safety, to preserve the healthcare workforce, to take care of the whole population, and also to make sure to protect their patients. Then you have that. That's clear cut. Then you look at the deaths of from coronavirus. If you look at the who is dying, over 90% of the patients who have died in Israel are 60 years of age and older. So those numbers are so stark when you look at them. Okay, that's not to say that those are the people who are the highest, who are getting sick in the highest proportions, but those are the people who are getting seriously sick, ventilated, and dying. So you clearly have to put them high priority to get vaccinated. And then, like that, you go down the list. After you deal with the 60 and up, what about the other medical risk groups? And that's the way you go down. And in the meantime, more and more vaccines are coming. And in the meantime, we're continuing to give the public health messages about masking and distancing and hygiene and avoiding crowds and being outside when you can. But if you make it a free-for-all, then you by definition, until you have enough vaccines in place, you put some people who are at highest risk at risk of not getting the vaccine that they need and that society needs them to have. That's the only way to do it. I agree. I don't think teachers who want the vaccine are not bad people. They're of course they're in front of a classroom, and of course they're at risk. But to say they're going to go on strike if they don't get it, what's on the flip side of that? It means that we think we should get it before people over 60, who over 90% of the people who've died have been in that age group. Maybe it's saying, I don't like all the Feuerlichtig that's been going on. I don't like the fact that this 30-year-old is able to cut into line because he knows somebody. And that is absolutely pasul. Okay, society, the medical authorities and the state decides a priority list. That priority list should be adhered to.
Okay, good. So we're drawing near to the end of our debate. There was some debate, and thank you for that. I would like to ask the question: what are we going to learn from this? I mean, we can see the horizon. What's the lesson? What's going to stay with us? I know it's venturing in futurology, which is a tricky field, but if you could say some words, I would really appreciate, and of course our audience may even more.
Well, I'd like to leave Rav Cherlow with the last word here, because as the man of Torah and spirit, so I'll take the first stab at this. What I think, if I had to sum up what we gained, or what in one word, what the lesson I derived from this year-long struggle with the pandemic is, it would be humility. Tzniut, because if you look at where human society was on the cusp of, at the end of 2019, you could really think that we had conquered the world. I mean, it would be legitimate. If we're people of faith, we don't go with that sense that we've conquered the world, but it would be legitimate to sort of just look at objectives where we were. We were a global society. You could get on a plane, you could be within a space of hours at the other side of the world. You had high-speed internet connections. You could transfer money without in a second. We controlled basically everything alive, and we were in outer space. Basically, we could perhaps be excused for having the mistaken belief that we were masters of our own destiny. And then comes this virus that's measured in nanometers, and at once it sends everybody home. It sends people to and it shuts the world down. And every time we think we have it cased, every time we think we know, we understand all we need to know, there's a new twist. So first we think it only causes diseases in the elderly, but then we see that it actually causes diseases in others. We think maybe it just causes pneumonia, but no, it actually can cause a whole variety of diseases. We think we have some medicines, and then we do studies and we see that the medicines really aren't that good. We have this great vaccine, and then the virus comes and mutates, but maybe the vaccines are still going to be good enough. We're constantly going back and forth. But if there's one thing that I take from this, it's let's have a little bit of humility. Let's accept that we don't know everything, and let's have respect for a number of things. Let's have respect for science and for the scientific method. Let's have respect for the planet and what is on the planet, and let's have an appreciation of the fact that we are not masters here, we're guests here, and relate to our time on Earth as such.
Cherlow?
Again, I'm sorry. There's no debate. I completely agree, and I think these are the right words to say. So, because you spoke about humility, I'll add humanity, and humanity is the second side of the picture, because we are in a crisis that is not only medical. I mean, business collapsed, people that are alone, and the youth that is lost their society, the social life, and everything. Actually, we see people that are under risk, that is not medical, that is their feelings, their emotional life, their friendship, their, as I said, business, their future. The families are in a boiling pot, and we know in Soho all the problems that they are. People, the numbers of crises that are inside the family. Families are broken, abortions, and really a lot of consequences. And the second thing is, after humility, that is the most important thing. The second thing is humanity. And humanity means learning how to understand people's losses and to be a part of them, not to forget the people that are alone, not to leave people that are facing and confronting so difficult situation, and not to forget them. The fact that the community and the congregation is so important in those days, because actually the government and the state authorities are not functioning in this crisis, or not functioning correctly. And you see the importance of the mayors of the town, of the congregation, all those things. I hope that we will use them even when we forget this disease, and we'll, find ourselves coming back to the world, not to forget all the humanity aspects of what happened in those days, and therefore we'll maybe more, look face to people, not to forget them, and not to abandon them, and to be with everyone together, understanding that actually we're all human beings, and we all have the same advantages and the same disadvantages and the same challenges and the same losses. And I think it may open a more soft relationship between people in the society. It may, I'm not sure. Maybe everything will come back and be exactly like it was before. But I can say I hope that we'll take also humanity from this crisis.
Okay. I'm gonna say I'm not sorry that this was a debate, because it was a very, very amazing conversation and lesson from two individuals who offered us a glimpse on how to think about this super complex issue in a way with such intellectual honesty that even if it wasn't a debate, I'm sure that it was amazing. At least I loved it, and I hope the audience also loved it. So thank you, Dr. Schwaber and Yuval. This was amazing. Thank you so much.
Thank you
Thank you for the opportunity.
It was
Thank
really
you.
wonderful.
So if you all want to ask questions, you can comment on Facebook, or if you want to ask questions to Rav Cherlow, tzohar.ethics@tzohar.org.il, or just search for Tzohar Ethics on Google. You'll get to our website, and you can ask questions about COVID or not about COVID. The Tzohar Center for Ethics will be there to answer you. And stay tuned here on our Facebook page. We always have activities, always have videos, and that's for you. Please, we're here for you. Thank you so much. Have a great evening, and we'll see you soon.
Thank you. Stay safe.
Stay safe.